Good evening, everybody, and welcome. I'm Jean Morrison. I'm the University Provost and Chief Academic Officer, and it's my really great pleasure to welcome so many distinguished alumni, board members, faculty, and students as we celebrate this really important milestone for the Boston University School of Public Health. We have a terrific evening ahead, an opportunity both to reflect on the 40 remarkable years and to look ahead to the School of Public Health's incredibly bright future. Before we begin, I want to take just a moment to give a special recognition to our Dean and holder of the Robert A. Knox Professorship, Sandro Galea, for his visionary leadership and for the creative energy that he and his team have brought to shaping the future of public health research, education, and practice and their broader societal impact. Sandro. Woo. It's often said that the measure of a civilization is not in its material wealth, but in the health of its people and in the way it cares for those in greatest need. For 4 decades, the BU School of Public Health has committed itself to this very premise, that success comes in the generation of new knowledge, new treatments, and new preventative care that improves the lives of populations. Over the years, and under the leadership of some remarkable researchers and clinicians, from Douglas Decker to Norman Scotch to Robert Meenan, the BU School of Public Health has seen such success and lasting contributions that have changed our approach to so many societal challenges. SPH faculty over the years have developed the research base for many of our nation's drunk driving laws. They've brought attention to physical disability as a public health issue for both high and low income countries. They've laid the intellectual groundwork for patients' rights and applied bioethics, and they're working to alleviate famine, infectious disease, and women's and children's health concerns in developing nations and around the world. For 40 years after its founding, SPH is a top 10 school of public health with thousands of alumni, faculty, and students making their mark both globally and in neighborhoods here in Boston, improving access to care, discovering new treatments, and even elevating the way in which we talk about public health. These activities are emblematic of a world-class institution committed to not only advancing the practice of public health, but to creating generations of citizens invested in their communities and assisting those in need. Tonight, I know I can speak for the entire leadership of the university in extending our congratulations as we celebrate this very special anniversary, in thanking Dean Galea for his exceptional leadership, and expressing our incredible excitement for what the next 40 years hold as we carry this proud legacy forward. So now I get to introduce the person who's going to introduce Dean Galea. And I'm delighted to welcome to the podium the chair of the School of Public Health's Advisory Board, Joel Lamstein. Mr. Lamstein is the co-founder and president of John Snow Incorporated and the JSI Research and Training Institute, which are both international public health research and consulting firms dedicated to improving the health of individuals and communities. A member of the faculty at the Harvard School of Public Health, he's also the president of World Education, a nonprofit organization committed to improving the lives of the impoverished through education, economic, and societal development programs. Ladies and gentlemen, Mr. Joel Lowenstein.
Thank you. I couldn't have written that better myself. In fact, I did read that. So I want to thank you very much, and it's great to see everyone here and to celebrate such an important occasion. You know, I rarely get the opportunity to introduce a dean from Malta. This is one of those rare events, and Sandro, thank you for that honor. I want to let you know that I have known Sandro actually for a number of years. We first met at the University of Michigan, and after that followed his career at Columbia University, where clearly he was a star and a friend of a number of people I know, and spoke incredibly highly about Sandro. I think it's really important to think about public health right now. Sandro and George Annis and others have written about how this is the time for public health. If you think about it, public health has never really gotten its due, although it's made major strides. Too often we've been focused on medical care, but not on the really important parts of public health. And because of cost, because of changes in structure, public health is going to become more and more important. And I think this is the time for Boston University to be one of the leaders. And I think Sandro is exactly the person who will do that. I also have, because I run this public health organization, I have some insights into the last year of, the first year of Sandro's reign here, both from, it is a reign, isn't it? Both from faculty members, from students, and from people at JSI who actually are going to school here. Every one of them has felt the new energy. Every one of them has felt the new vision that Sandro has given this school exactly at the time that I think it's really necessary. So I would want to introduce Sandro. I want to just say one other thing, and that is those of you in Boston didn't probably get your Boston Globe many times on Sunday, but you always got the dean's note on Sunday morning. So Sandro, thank you.
Well, good evening. It's always a pleasure to be introduced by Joel. I like people who can set a low bar for us. We're competing with the Boston Globe on Sunday, so it's okay. I feel with that metric we are bound to succeed in spades. So thank you, and I'm glad I could give you the opportunity to introduce a dean from Malta, or maybe this is the dean from Malta, as far as I'm concerned. It's really fantastic to be here. Thank you all for coming. Thank you, Provost Morrison. Thank you, Joel, for the introduction. So a couple of words. First of all, I want to remember why we're all here. And for faculty, staff, students, alumni of the school, you've heard me say this many times, but we are here because we believe that public health should be a central player in creating a better world. The United States right now kills more of its own babies than any other peer rich country. In the United States, a black baby has about 2.5 times the chance of dying than a white baby does. And a baby born in Ethiopia has 10 times the chance of dying than does a baby born in the United States. That is why we are here. And I think that is what draws us to public health and to the school's immense credit. This is what it has drawn all of us to the school. Every single student, faculty member, staff member, alumna who I talk to, they all say that they came to the Boston University School of Public Health because they believed in this mission. And that is a pretty powerful equation for us to live for. And when the day gets long and when things are not going so well, knowing that you're part of something bigger than yourself is really the best way to say, I am moving forward because what I'm doing is worth it. And that's how I feel about our work here. Thank you all for allowing me that opportunity to be a part of this. I think that any school that does a year-long strategic thinking initiative and articulates for itself that it cares about significant issues, it cares about diversity within its walls and outside its walls, it cares centrally about health equity, and it wants to do that cross-sectorally in collaboration across disciplines, is a school worth dedicating time and energy towards. Thank you. So a couple of things which I am going to do. First of all, it's my great pleasure to unveil a video about the school. It's we have been developing a short video, 2 minutes, to commemorate the school and to articulate what the school believes in. The intention behind this obviously will be used for our 40th anniversary celebrations, also will be used for students and our outreach to make our mark on the world. I will thank the people behind this shortly, but first, let's see the video. This is the part where you get anxious about technology.
It really doesn't have to be like this. In the year 2000, poverty and income inequality claimed nearly 300,000 lives in the United States. Yes, in the United States in 1 year. Add to that number 162,000 deaths related to low social support, 176,000 deaths related to racial segregation, 245,000 deaths related to poor education. Bad drinking water, sanitation, and hygiene killed 842,000 people around the world in 2012. These numbers, they're not data, they're not math, they're not statistics, they're people who have been failed by outdated, inadequate, unsuccessful approaches to health. It really doesn't have to be this way. At the Boston University School of Public Health, we are leading the effort to improve public health here in the neighborhood and around the world, now and into the future. In 1976, we started with 5 programs. Today, our 6,500 plus alumni, 250 faculty, 250 staff, and 1,000 students from 50 countries are out in the world working to turn those numbers around. Here in Boston, we have under our roof some of the world's leading public health researchers who are investigating new ways to break through. We are generating ideas to solve crucial public health challenges, teaching those ideas to the next generation, communicating those ideas to the change makers who can make them happen on a global scale. We are leveraging the networks, brainpower, and resources we have built over 4 decades to make progress, to deliver impact, to change the way we live and work. We developed the research base for drunk driving regulations adopted nationwide that have saved tens of thousands of lives. We lay the intellectual foundation for bioethics and patients' rights in America and around the world. We demonstrated the impact of community-based antibiotic therapy for childhood pneumonia in resource-poor settings, generating a major change in World Health Organization guidelines. So you see, it doesn't have to be this way. But no one person or organization or institution can do it alone. But if we join forces, we can change what needs to be changed someday. Of course, someday doesn't just happen. At the Boston University School of Public Health, we have the people, the dedication, and the knowledge. We have the network, the resources, and the passion. In other words, we have what it takes to take this on together.
Obviously, it takes a lot of people to do a video like that, but I want to single out Cara Peterson, who has been the shepherd of that video since inception. I'd also like to point out with some pride that I believe it's the first promotional video for a school that does not feature the dean. That was my only condition going in. No thoughtful dean pictures. I wanted to liberate the podium, but I have 6 thank yous I need to make, and then I will liberate the podium. So first of all, I would like to start by thanking President Brown in absentia and Provost Morrison. The President and Provost have been, since my first contact really with this position, when I was auditioning for the position, a little bit like Survivor, they have been deeply supportive of the mission of the school. They've been deeply supportive of the mission that I articulated for the school. They have made it possible for us to actually do interesting, exciting things by investing in the school. And they have followed through every day since I've been here on their promise to really make the School of Public Health part of the beating heart of the great research university. So thank you for that. Second, and this is in no particular order, I want to thank our board. I want to thank Joel. I want to thank Janine, who's here on the board. We have several other people from our board, Jim and Sheldon and Betsy, and the friends of the school who are really, in many ways, I think the school community has a, sort of the board is invisible to the school community, and we're trying to change that. But I thought it was important that everybody knows that behind everything we do, there are people who are giving of their time freely and supporting us and who are helping us with the ideas that we're moving forward, and we are immensely grateful to them. Third, I want to thank the people who have built this school. The school has been around for 40 years. And the school would not be what it is today without the work of a lot of people, a lot of faculty, a lot of staff, many of whom have passed through the school, are no longer here with us. But in particular, I wanted to single out Dean Meenan, who really is the person who made the school what it is today. Dean Meenan. Number four, I want to thank the people who actually made an event like this happen, the people who are making our 40th anniversary happen. That is a lot of people, but I just want to highlight that really the leadership of that, of this event, and of all the events we're doing on our 40th anniversary rests with the really four leaders in the Dean's office, who are Susan Foster, who heads up our administration and finance, Catherine Ettman, who heads up the Dean's part of the office, Leslie Calderman, who heads up development, and Cara Peterson, who heads up communication. They have been doing an extraordinary amount of work. Fifth, I would actually like to thank my family, in particular single out my spouse, Margaret Crook, who's standing right behind George. I would like to thank Margaret and our kids for, being game to me saying one day, apropos of nothing over dinner, what do you think about moving to Boston? And Margaret sort of, tries not to choke on her food and says, that's an interesting idea. Let's talk later. Several years and months later, here we are. It really has been an extraordinary journey together, and thank you. And my sixth thanks is to all of you, to the school community. This is one of the central reasons I took this job, is because I think this is just an extraordinary school community. It's a community of just really nice people. Doesn't mean they get along all the time. Far from that. So, God, I call that Tuesday when people don't get along. But they're just good. It's a really great community, and of people who care, people who actually believe in what they do. And I mean that when I say the school community, I mean our alumni, our students, our faculty, our staff, and the friends of the school. I think this is just an extraordinary community which has played and will play an ever greater role in public health, in the public health conversation domestically and globally. And it truly is an honor and privilege to be a part of it. Thank you. Thank you all. Thank you. So we're going to hear remarks from two more people, and I will introduce them very briefly. First, I would like to introduce Janine Rivet, who is going to speak as an alumna, but Janine graduated from our school in '81. But I just want to point out, I'm not going to do biographical information. Janine can talk about that herself, but I want to point out that Janine has served as chair of the board and a member of our board for a long time. She's recently stepped down and handed over to Joel. It really is, there has been no more loyal friend to the school, no more supportive friend to the school than Janine. When I was first announced as dean, she reached out to me. We met, I remember clearly, in New York when she was passing through, and she created space for us to talk for like several hours for a meeting that she was organizing, where I could, as a new guy, get advice, and it was advice that has stayed with me to this very day. It really has been an honor and a privilege knowing you. Janine.
Thank you, Sandro. Thank you all for being here. Isn't this exciting? I love the entrance with the lights. That was fabulous. So yes, I'm an 81 graduate, 35 years. I had to think about that. That's a long time. It will be 35 years. It feels like it was not that long ago. So I got my MPH shortly after we started the evening program, and it was part-time, and it was fabulous for me. I was at a crossroads in my career where I'm a nurse by training. I was doing nursing and clinical work, but I was also an administrator in a health plan. Now we call them health plans, then we call them HMOs, and in a clinic. And I had a fabulous leader who said to me, you can't do both, pick one. And so I had to really sort out, what did I want to do? And I thought, well, I'm in pediatrics, I love children, maybe I should be a nurse practitioner. Well, if I'm going to do that, I was in Rhode Island, right up the street is Brown University. They were giving scholarships for medical school to nurses and females. I thought, well, I'll get an application, and I looked at that, and I started filling out the application to be a physician. And I thought, am I going to have the same impact being a physician as I could being in a leadership role in administration? So then I looked at MBAs. Well, the MBAs in the 70s were more finance, accounting, economics, with a good marketing class thrown in for good measure. And I decided that wasn't for me. And somebody said, well, why don't you look at BU? They just started this program. It's really good. It's part-time. And my passion was working and learning on the job, and this was part-time. And it was with other people who were like-minded. And I thought, I think that could be for me. I came and met some of the staff and the faculty, and I knew it was for me because they were flexible, they were adaptable, they were creating a healthcare administration track that was perfect for me, and it was just a great opportunity. And it was a 3-year program, which I did in 2 years. So those of us who go to BU are a little more aggressive and assertive. And I went ahead and did summer classes, and I wanted to get through it so that I could apply everything I was learning. And it was a wonderful blend of a combination of all the public health components as well as business and law for me. And it was just perfect for my career. So what was the impact for me as an alum, an old alum, 35 years? So my first impressions were fabulous. Through the whole 2 years, everything I did and everyone I met were great, including the classes that I wondered if I'd get through, like biostatistics, but I did, and it was okay. I learned a lot, and I still apply it, so that's good. But it made a difference in my career. A year later, because of the MPH, I started getting different job offers to go to different parts of the country. And I had the opportunity to work in very many companies, all because people called me and they liked my credentials, and public health was a big part of that. I now have worked at United Health Group, for those of you who don't know me, for 25 and a half years, and I've had many, many roles in the company. I've run several of our businesses, significant businesses. It's been a privilege for me to do that, and I've been able to apply public health to all of those roles. So it's been fabulous. So my engagement at the school, Sandro mentioned that I've been on the board for a long time, 17 years, I looked it up, 17 years. So I've been on the Dean's Advisory Board for a long time. With that, I've chaired, I've been with Dean Meenan, I've been with Dean Galea. And it's been a privilege to do that, a privilege to see the growth of the organization. My contributions have been, I've been a commencement speaker, I give to the annual fund, I have given to the capital campaign, and this is my commercial. Those of you who haven't given to the annual fund, I highly recommend you do that. Those of you who haven't given to the capital fund, I highly recommend you do that. This is a school that is doing great things, and it's money well spent. Small dollar amount, large dollar amount, we take it all. You'd think I was still encouraging. Yeah, I am. But my observations about the school, growth, scale, impact on students and on society globally, really important. I describe it as the school is growing up. It's getting to a new phase. I now look back on the 40 years of development and success with grateful appreciation for the experience that I had and the experience that others have had. I appreciate Dean Meenan's leadership, drive, and setting the groundwork to get to where we are. I call it the internal phase. We needed that to get to where we are today. We're now ready for the next phase. 40 years is a long phase. However, it was necessary. The new phase, I welcome Dean Galea's passion, compassion, and vision. He's going to take us to the next generation of population health and public health. So Sandra, this is a quote that was very reflective of you. It is Charles Lindbergh. It is the greatest shot of adrenaline to be doing what you've wanted to do so badly. And I see that in Dean Galea. I see that in the Lancet article where he said, this is a school of believers. This is a school committed to, and I have to get your quote right, to real world practice, and he means it. And this is what we're looking forward to. So now as I look forward to the next 40 years I look at it with excitement and with pride for where we are and where we're going to be, and that's really terrific. And I leave Sandro, and I leave all of you in the school with this last quote by Mary Parker Follett. The insight to see possible new paths, the courage to try them, the judgment to measure results, these are the qualities of a leader. And I see that in you, Dean Galea, and I see it in the school. So I would like to just thank you for being here today. And I don't think I'm going to be at the 80th anniversary, because I'll be 107 then. But I'm aiming for the 50th, so I'm looking for the 50th, the next 10 years. Thanks for all of you in the room, for all that you've done, all you will do, and thank you, Dean Galea, for the future.
Thank you, Janine. I have nothing to say about that. Our last speaker is Eva Zaret. Eva is a student in social behavioral sciences. And one of the changes that we've made in the past year is we've really been working hard to make sure that students are engaged in all aspects of school leadership, including the highest level of leadership at the governing council. So when we first made this change, there was some natural reluctance on students' part, but Eva came forward as president of the Student Senate and said, yes, I'll do that. And she has been a full-on member of our governing council. It's been really a pleasure to have you with us. Eva.
Hi, everyone. Thank you for having me, and thank you for being here tonight. As may be the case for many of you in public health, my journey into this field has been a winding one. During my time as an undergrad, I knew that I was interested in health and wanted to help people, so I thought about becoming a doctor. But after too many semesters of chemistry and physics, it was an internship at Planned Parenthood that opened my eyes to a field that could allow me to affect change in health in a larger scale. And in this way, I stumbled into the challenging, vibrant, hard-to-define field that is public health. And just as my journey into public health was not a straight shot, my journey to this school was not a straight shot either. Choosing a school seemed like an impossible task until I came to Accepted Students Day. The energy, passion, and enthusiasm that I felt radiating from every faculty and staff member filled me with inspiration and warmth. I truly felt at home, and I knew that this was the place where I could become the best public health practitioner possible. A scholarship and my financial aid package made me feel like the school wanted me as much as I wanted them, and it really made it possible for me to follow my dreams. And I had picked my school. BUSPH was like a net that caught me as I tumbled into public health, full of eagerness and passion, but a little short on skills and knowledge. Just as it has done for thousands of students over the past 40 years, this school has guided me, taught me, and given me more opportunities for learning than I can even say yes to. With every class that we attend, every remarkable guest lecture that we see speak, every conversation and debate that we participate in, we become more skilled and knowledgeable, but also more eager and more passionate. The school fosters in us fierceness, compassion, and a sense of justice. We are change makers, we are activists, we are leaders. I don't expect the path after SPH to be straight shot either. Public health is practiced in the context of a dynamic and ever-changing world. New challenges arise regularly, and old challenges present new concerns. This is why public health is for the brave, the creative, and the tenacious. But when I am released, so to speak, into the world as an alumna, I will feel confident that my time at BU has prepared me for the challenges ahead. BUSPH looks to the future with grit and determination, and I'm proud to be part of a school that looks to the next 40 years with its head held high and says, bring it on. Thank you.
The good news is I'm about to release everybody back to the party. Before we do that, I would like to acknowledge that we have a gifted person who works with the school. That's Meg Keating, who makes all these events possible. She has Meg has brilliant ideas about things like lighting, which I have absolutely no understanding of, and it all seems to work. Thank you, Meg. But thank you all for coming. Thank you all for being here. Enjoy the party. Have a good evening.